Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to discuss in detail about a safety device known as restraint. Before we move on to the topic, as we all know that any activities which focuses on the health promotion as well as on the illness prevention is also involved in promoting the client's health, right? So why do we use these safety devices? Why do we provide these safety devices for the client? We do these because, why? Because by doing this, it also helps to reduce the length as well as the cost of the treatment, the frequency of treatment-related accidents, as well as the potential lawsuits and the number of work-related injuries to the personnel. So here, why do we provide any safety device? We do this in order to reduce the occurrence of the hazards, right? In order to reduce the client from injuring himself. That is why we provide these safety devices. However, there are also certain devices such as side rails, restraint, grab bars, non-skid slippers, where we will be providing for the client in the hospital setting in order to prevent them from any accidents. And also, it is not necessary that you only provide the safety devices, but it is very important that you must also maintain a safe environment for the client. Why? Because if there is a safe environment present in the hospital, then it encourages the client to assume a more active role in the healthcare practices. So I hope you've got a clear understanding of why is it important to provide a safe environment and also safety devices for the client. Now moving on to restraints. So what are these restraints? These restraints in a medical setting are the items that limit the movement of the client. By the use of these restraints, we can help the client by preventing them from falling, from harming themselves, or even from harming the others, such as the caregivers. These restraints are also used as a last resort. So these restraints are also a protective devices which is employed to prevent the client from harming themselves or from harming the others, as well as to immobilize any area of the body that is required, to restrict the activity of the client, as well as to promote a feeling of security in a client who needs control. Now moving on to the definition of restraint. So this restraint is defined as a forcible confinement or any control of a subject as of a confused, disoriented, psychotic, or irrational person. It may either be physical or a chemical restraint. Restraint of any kind is only used when the behavior of that particular client presents a danger to himself or herself or even to the others. So what do we mean by restraint? In simple words, I can say that these restraints are the safety device which are used in order to hold an individual in that particular place or even to immobilize any part of the body which needs not to be moved. And these restraints can also be given to the confused, psychotic, disoriented, as well as to an irrational person. And these restraints are also of two types, that is the physical restraint as well as the chemical restraint. So depending on the condition of the client, you can choose which one is to be given. We not only use these restraints to hold a person in that particular position or in that particular area, not only to immobilize any part of the body, but we also use these restraints in order to protect the client if you find that the behavior of that particular client can be harmful or it can be dangerous for himself, herself, or even for the others. So since I have said that these restraints are of two types, the physical restraint as well as the chemical restraint, right? What do we mean by physical restraint? These physical restraints are any manual method or physical and mechanical devices, material or equipment which is being attached or adjacent to the body of the client that he or she cannot easily remove, that restricts the freedom of movement or normal access to one's body. So what are these physical restraints? These physical restraints are the one which will restrict that particular body area from moving, right? So we usually use this to immobilize any part of the body, and these are usually a manual method, that is we can restrain the client by the use of any physical or even mechanical devices, equipments, whereby we will be attaching or even placing this device adjacent to the body of the client. And the second one is the chemical restraint. So these chemical restraints are any medications which is used for the purpose of restraining patient involuntarily to prevent them from harming themselves or even from harming the others. The purpose of using this chemical restraint, or we can say the purpose of using this medication, is for a long duration of action as compared to the brief conscious sedation, which is commonly used to facilitate any procedures such as suturing. So in simple words, we can say that these physical restraints are the restraint whereby we will be immobilizing any part of the body, or we will be restricting the movement of the client by the use of any physical or mechanical devices, right? Whereas these chemical restraints are the restraint which we will be providing in the form of medications. And the example for this chemical restraint can be the sedatives. So what are the objectives of these restraint? As I've said right from the very beginning of this topic, that we use these restraint in order to prevent the client from harming himself, herself, or even from harming the others. These restraint are also used in order to prevent the client from falling. It is also used to prevent interruption of therapy. Why? Because here we may have witnessed that there may be times while we are providing certain therapy to the client may not be cooperative, right? So in order to be able to provide the therapy in a way it is required, we sometimes even use these restraint. We also use this in order to prevent confused or combative client from removing any life supportive equipment, and then we also use these restraints in order to reduce the risk of injury to others. So till here we have discussed about what is restraint, what are the two types of restraint, as well as what are the objectives, right? Now moving on to the types of restraint. So here there are different types of restraint. The first one is the ankle and the wristlet. The second is the elbow and the knee restraint. The third is the mid restraint. Then we have the safety belt, the body jacket, as well as the mummy restraint. So now let us discuss about each of these restraint in detail. The first one, as I've said, right, it is the ankle and the wristlet. These restraints can be made up of leather, plastic, linen, canvas, wood, or even metal. These anklets and wristlets are the restraints which we will be using in order to restrict the activity of the limbs in a client who are potentially harmful to themselves and even to the others. And why do we use these type of restraint in them? We use it in order to prevent them from removing any appliances which is used for the treatment, and this can also be done to immobilize one or more limbs while any procedure is being performed to them. So here, for example, violent behavior of a client in the hospital. So here, if there's a client who exhibit this violent behavior, then what we can do is that we can use this anklet and wristlet restraint, where we will be able to restrict their movement. We will be able to restrict them from removing any equipments or any appliances that is being connected in order to provide care for them. So as you can see in the picture, the anklet restraint are the one where we will be providing in the ankle, as well as the wristlet restraint are the one where we will be providing in the wrist of the individual. And the second one is the elbow and knee restraint. So these restraint are the one which we will be applying in order to prevent flexion of the elbow as well as the knee joints. This elbow restraint is commonly given to children in order to prevent flexion of their elbows, so that they will not be able to remove any tubing or dressing which is done on their body. So in the picture, you can see the elbow and the knee restraint. Now moving on to the next, which is the mid restraint. So this mid restraint can also be used for children as well as for the confused patient in order to prevent them from using their fingers or their hands to remove any tubings, dressing, or any other appliance which is used in providing treatment for the client. And this mid restraint can also be given to children in order to prevent them from using their hands. So in the picture, you can see what a mid restraint look like, right? Now moving on to the next one, that is the body jacket. So as you can see in the picture that this body jacket resembles the jacket which we use it in our day-to-day life, right? So these body jackets can be used for both children as well as adults. These jackets is usually put on and tied at the back, where the straps of the jacket are then tied on the bed frame under the mattress, thus preventing them from sitting on the bed. So here what we will be doing is that we will be telling the client to wear the jacket, and then we'll be tying the jacket on the back, and also here the straps from the jacket are then tied on the bed frame under the mattress. So in this manner, the client will not be able to sit on the bed, whereby they will always be in the lying position. The next one is the mummy restraint. So these mummy restraints are usually given to children in order to restrict the movement of the limbs, especially when any procedure is performed for them. So here these mummy restraint, as you can see in the picture, is like wrapping the child, right? So here this mummy restraint is only given to the child, whereby we will be wrapping the child in order to prevent them from moving their limbs while any procedure is being performed for them. And the next one is the safety belt. So these safety belts are made up of electrically non-conductive material, which is frequently used on stretchers as well as on the operation tables in order to prevent the client from falling. Through the use of the safety belt, it can also prevent the client from getting down from their bed. These safety belts are also a type of restraint which will be provided in order to prevent the client from leaving their bed. So those are the different types of restraint. However, we can also use the splints, the plaster cast, the sandbag, bandages, binder, and splints in order to restrict the movement of different parts of the body. So in order to prevent the client from falling, from injuring himself, or even from any kind of hazards, we can also use the side rails. So here these side rails, as we all know, are attached on both sides of the bed and is mainly used to prevent the client from falling or to prevent the client from leaving their bed, right? So here, in order to prevent the client from falling or from leaving their bed, we can also use the side rails, and we can also provide the client a seclusion or a quiet room. These rooms are specially designed to be hazard-free and are commonly given or are commonly used by the psychiatric patient. So what are the hazards of restraint? The first one is that sometimes you may encounter that client may have tissue damage if they are using these restraint because of constant friction. It can also lead to a damage to the other parts of the body. And also, as we know that certain restraints are given in order to prevent the client from sitting or leaving their bed. For example, the body jacket. So because of this, it can also lead to the development of the pressure sore. There can be development of hypostatic pneumonia. There can also be nerve damage as well as ischemia. There can also be foot drop or waist drop, or even asphyxia or aspiration pneumonia. There can also be a development of other complications such as inability of the client escape from injury or death, as well as inability of the nursing staff to resuscitate a client in time. It can also lead to a psychic injury, whereby the client may be having a feeling that he or she is being punished. And it sometimes can even lead to strangling and death. So whenever we are restraining the client, whenever we use this type of restraint, we must keep in mind what is to be done and what is not to be done. So when we are providing these restraint to the client, these are the various things we must also keep in mind. Now moving on to the next, that is the general instruction. So here, before you provide any restraint to the client, what are the various things you should do? You should first explain the need, the application, as well as the type of restraint which you will be providing for the client. And why do we do this? Because there is a need that the family members, the friends, or even the client needs to know why are we doing it. However, whenever you are providing these restraint, you must keep in mind that it should be used with a greater care. Assistance should be given when required, and we should also allow them the freedom to move. And even when you are providing this restraint, you should make sure that the circulation should not be occluded. You should also pat the bony prominence, as well as when you are applying these restraint, you should see that the normal body position of the client can be assumed. You can also untie the restraint at least every 4 hours so that the client will feel comfortable. And a client to whom these restraint devices had been provided, you should make sure that you should always visit them at least once in every 30 to 60 minutes. You should never apply a linen restraint with a regular knot. And whenever these restraints are being used, you should make sure that you fasten it to the bed frame and not on the side rails. And when you provide these restraints, you should make sure that you should not use it over an IV side. While removing these restraints, you should also make sure that you remove one at a time. And also, if you find that there is presence of skin folds, then you should make sure that these should be clean. And also, before you provide these restraints, you should make sure that that particular area is dry. And the last one is that you should ensure that there is no wrinkles on restraint. So these are the various things that you need to keep in mind. So now we have come to the end of this topic. In today's session, we have discussed in detail about restraint. We've come to know what does restraint mean, what are the various types of restraint, as well as why is it being given, as well as we've also discussed about the hazards of restraint, as well as what are the various things we need to make sure before we provide these restraint devices. So I hope you guys have got a clear insight of this topic. So I'll be meeting you in another session whereby we will be discussing about the other safety devices such as the grab bars, the side rails, the non-skid slippers, as well as the alarm. So until then, have a good day. Thank you.